If I had to name this historical era, I'd call it the rise of the entrepreneur. This country was created by people striking out on their own. We see even more of that today. It's also the era of Regus, a new way to work. You talk about right for the times. A Regus virtual office is perfect for home offices or expanding businesses who need a more professional image with clients. You get a prestigious business address to call your own, an on-site receptionist for unlimited call answering, access to meeting rooms, use of a private office, too. A Regus virtual office is the right idea for the rise of the entrepreneur. Look, folks, I know what I'm talking about here. When Catherine and I started our own business, 2If by T, we turned to Regus, and so should you. Regus makes setting up your virtual office so easy. Just call Regus today. Let them know Rush sent you, and you'll get 2 months free. Go to Regus.com/Rush now or call 1-800-OFFICES. That's 1-800-OFFICES for Regus.
Brick Street 360, an innovative approach to workers' compensation. Brick Street, your business, your people, you're covered. Go to brickstreet.com for more. WCHS, Charleston, a West Virginia Radio Corporation station.
Lazy Boy Furniture Galleries has lost their lease in Charleston and must close soon. They must sell off the entire inventory of top-quality Lazy Boy furniture immediately. You'll find discounts of up to 70% off top-quality sofas, love seats, recliners, sleepers, occasional chairs, leather furniture, tables, lamps, pictures, accessories, and more. And not just in the Charleston store. Every discount and every price cut is being matched in the Barboursville store, too. This is your best opportunity to buy top-quality Lazy Boy furniture at unheard-of store-closing liquidation prices. The family will continue to serve you at the Lazy Boy showroom in Barboursville. But if you're even thinking about a home furnishings purchase, right now is the time to take advantage of these historic low liquidation prices. Lazy Boy Furniture Gallery store closing, McCorkle Avenue and I-64 in Charleston. Matching all prices at 20 East Mall Road in Barboursville. Don't miss out.
Here's the 58 WCHS AccuWeather forecast. A mixture of sunshine and clouds for today. It'll be very warm with a high near 80, then turning out mostly cloudy for tonight. It'll be mild with a low 55, then cloudy and cooler tomorrow with showers and maybe a thunderstorm with a high 61, then mostly cloudy and cooler Sunday, high 56, then some sunshine returns Monday, high 56. I'm AccuWeather meteorologist Christina Baker on 58 WCHS, the voice of Charleston.
The views and opinions expressed on this program do not necessarily reflect those of the management of 58 WCHS or of West Virginia Radio Corporation.
Well, good morning to you and welcome to Ask the Expert. So glad to have you joining us this morning as you kick off your weekend. We're glad to do that with you. Our guests this morning are Dr. Jeannie K. Bailey. She's no stranger to the show. She'll be talking to us about a range of things, including sleep apnea and how we test for that and what kinds of options there are for you to deal with sleep apnea. She's brought a special guest with her today as well, and that's Dr. Stoltz. Dr. Stoltz is also a person who deals in sleep apnea, also helps to design the product you may be using to best help you deal with your sleeping problems, and we're going to talk at a wide range of those. As you're listening to us this morning, I encourage you over this next hour to make a call in to 345-5858, 345-5858. Anthony will get the calls and bring them to us here during breaks or whenever you call, actually, with any questions you have regarding sleep apnea. So keep that in mind and know that we're anxious to answer any questions or go in any direction that you'd like to go with regards to that. I would like to kind of, since we have the two guests here today, Dr. Bailey's, maybe talk about what you both do to serve each other, to help each other campaign in this arena of sleep apnea. Maybe you can just give us a little idea of how that works.
Yes. Good morning, Rick.
Good morning.
Good morning, Dr. Stoltz. Thank you very much for coming and being a guest today. The dentist and the sleep physician work together hand in hand. Of course, I always need a sleep physician. She's board certified, and she's from Barboursville. And I have to have a diagnosis from a physician before I'm allowed to treat the patient. And this comes about by insurance. Insurance kind of dictate, if I don't have a proper diagnosis from a board-certified physician, then insurance will not cover the treatment that we do for sleep-breathing disorder patients. Good morning, Dr. Stoltz. Would you tell us a little bit about your practice?
Yeah, I would love to. I have Bruceville, West Virginia. It's a sleep medicine practice and behavioral medicine. We have a fully accredited sleep lab and can do in-house sleep studies as well as home sleep studies if necessary. So where we can diagnose and treat a variety of sleep disorders. We treat not only sleep apnea, but also insomnia and narcolepsy and restless leg, and any kind of sleep complaint you might have.
Well, can you expand on that a little bit and just go with me on this for a minute? I've never had a sleep study done, although I do like to think of myself as somebody who deals with sleep problems. Well, I know I do. I have had issues in the past that have caused me to be very awake at night.
Okay.
Even when I'm physically fatigued, my brain tends to stay high charged late into the wee hours. And I'm one of those guys that goes past 1 o'clock and feels a little nervous, watches 2 o'clock go by and gets extremely upset. And by 3 o'clock, there's no going to sleep because now I've aggravated myself past the idea of being able to get back up again.
Absolutely. The harder you try to sleep, the less likely you are to sleep.
Yeah, and what if I was to have a study done with you, what would be the process I would go through with you? As you said, you could do this at home or you can do it in the lab. Is it easier to do at home than in the lab?
Well, you get more information in the lab. You know, we're biased, that's what we do. But the home sleep studies will kind of tell you how your breathing is and your oxygen level, but it doesn't diagnose some of the other disorders. And sometimes what we get from an in-lab study is we can see how much you're moving around or how much you're kicking in your sleep, which is called periodic limb movement disorder. We can also see how fragmented your sleep is and if you're getting the deep restorative state of sleep. We do an extensive sleep questionnaire, so we kind of try to find out what other symptoms you might have. So, you know, there's advantages and disadvantages.
Are you? Would you say that your mission is to try to develop a natural sleeping pattern for the natural
yes.
sleeping pattern versus, say, Ambien at night or other sleeping aids?
Right. We do a lot of behavioral medicine, of course, in my practice. I'm a psychiatrist by trade initially that went into sleep medicine. So we work a lot on behavioral things that you can do to help people sleep. You know, for instance, with your sleep problems, you really have to retrain yourself to sleep. And the harder you try to sleep, the less likely you are to sleep. So we work really hard at finding out what's the order of things you do, how you try to unwind. You almost have to start a bedtime routine like you would with a little kid. You start about an hour before bedtime, winding down, doing something calming. Taking a really hot bath or hot shower can help because decreasing, like your body temperature getting very hot and then cooling down can help promote sleep. Listening to some relaxing music, doing some non-stimulating things. Aromatherapy, we're big into using aromatherapy.
Like it seems to work.
Oh, yeah. If I have trouble sleeping,
Lavender.
I'll put essential lavender oil, and I'll just put it on my temples, and that kind of helps and stuff. So you want to make your bedroom environment very peaceful. You want to have a comfortable environment. We try to tell everybody to use their bed for sleep and intimacy only. But nowadays we all have computers and iPads.
Oh,
and,
yeah.
You know, that's one of the big causes.
right next to you, and
right.
You stop talking on the iPhone at about 10 o'clock in the evening, but then you start working out in other areas that you found interest in, you know, including exploring the internet and all.
That's right.
Interesting. Okay, so you're doing the studies, and we'll flip back over to there in a little bit, but Doctor, I just wanted to, Dr. Bailey, go back and remind people about the apnea problem. Just exactly what is apnea for those who aren't tuned in or haven't picked up on it yet. What is sleep apnea, and how do you know if you're a person who's dealing with it?
Well, you have cessation of breathing. You just stop breathing at night for over 10 seconds. So that's the apnea portion of it. And there's different forms of apnea. And if your bed partner is snoring a lot, that doesn't mean you have sleep apnea, but that's an indication.
Okay.
So you really should check with a physician to see if that is an option for it. But just the cessation of breathing is the apnea.
How dangerous is it to stop breathing for 10 seconds at a time? I have gone through this. I have felt it happen, but it's never been chronic. It's been an occasional thing. Maybe I've eaten too much or laid on my back. I don't sleep well on my back.
Right.
It feels like I have pressure on my lungs or something, and I don't get good breathing anyway. I don't feel comfortable breathing when I'm laying on my back. But on my sides, I seem to be okay. I'll open up and I can breathe fairly well. But I have had episodes where I've awakened choking or gasping, as we talked in previous shows, kind of gasping for air, and then change positions and okay.
Now, he just did something really great. I hope the listeners heard him go,
Yeah.
You know, that was the big sigh. And what you did when you did that is you received more oxygen. So when you have a cessation of breathing at night and it's 10 seconds or over, and Dr. Stultz can testify, we have some people who, for over a minute, do not breathe. So that means the body's going without oxygen for a prolonged period of time. That's not healthy. Dr. Stultz, why don't you tell them some of the side effects when you don't get that oxygen? What happens when you do not get that vital oxygen to keep you healthy?
Oh, it can affect so many things. Memory and concentration. There's a lot of health disorders now that are clearly associated with untreated sleep apnea. A higher risk of hypertension and heart disease, strokes, diabetes. Also, not getting enough sleep and good quality sleep is associated with weight gain. That's a huge one right now.
So if you're not sleeping every night, your allotted time by say some study, say I'm supposed to get 8 or 9 hours of sleep a night. Mm-hmm. Then if I'm not getting that, frankly, what's happening is I'm allowing myself open for those diseases and, of course, weight gain.
Yes, that's right.
Why does that happen? Why does weight gain become part of that?
Well, a lot of it is hormonal and getting into those deeper stages of sleep and stuff that I talked to you about earlier. Mm-hmm. We need to have consistent sleep. And then, see, each time you wake up, like, you know, you're telling us that you have trouble breathing and you wake up, it arouses your brain and you go into a lighter stage of sleep. So you're not getting the pattern where you progress into the deeper stages of sleep.
You're like starting over again.
Right. So it's all real fragmented and light. So we need, less than 6 hours of sleep is certainly associated with weight gain, but most adults need 7 or 8 hours of good sleep.
What if you're a person that has to be up a good portion of the night because you have to go to the bathroom?
Yeah.
So that same thing. I mean, basically, you're coming out of a deeper sleep into a lighter. Then you have to work yourself all the way back into the deeper. So you're going to start feeling tired even if you've been in bed the whole
Absolutely.
time.
There are so many reasons you can wake up in the night, but actually having to go to the bathroom in the middle of the night is a symptom of sleep apnea.
Really?
So if you have that, especially men, that's right on the checklist of things for sleep apnea.
Wow.
And the body's doing that because it wants to live. I always look at the body sort of like a computer. You know, when she says you wake up, you're interrupting the program. Your program at night is computerized. You need to sleep. So you wake up many times and you're interrupting your computer. And when you get up to go to the bathroom, that's your body telling you you want to live. It makes you get up to get that vital oxygen and breathe. So that is one of the symptoms.
Wow. So it's basically your body doing what it has to do.
Right. Yeah. I mean, there could be other things like prostate problems in men and stuff. And, you know, we always tell people to try to limit their fluids after 6 o'clock and make sure they go to the bathroom right before bedtime and stuff if that's a problem.
And stay away from caffeine, obviously, or foods that can be stimulating as well.
You know, you mentioned that you feel like you're choking when you're laying down. One of the other big things that can be a symptom of sleep apnea, but a lot of people haven't and don't think anything about it, is gastroesophageal reflux. You know, that reflux symptom when you lay flat and stuff, that can be a symptom of sleep apnea. And the sleep apnea can make it worse, and the reflux can make the sleep apnea worse.
Wow, feeds on each other.
Right.
Yeah, I've had that. I cannot eat anything past say 8 o'clock in the evening, and I go to bed late. It's still it hangs on, and I do have that reflux where I actually end up with stuff clear in my throat, and certain things cause it worse than others.
Right.
But I do keep water at bedside all night long. It's just a comfort thing. I'd never drink a glass of water all night long. I'd drink sips of it. Mm-hmm. But when I wake up, I like to have a sip of water. It kind of refresh my mouth, and it helps me to go back to sleep.
And you just said something else. You know, you did the gas before, and you're telling me to refresh your mouth. You're probably snoring and mouth breathing, and it's very dry. So that's also a symptom when you have the very dry mouth that you've been snoring.
I don't snore.
Ha ha.
Oh, Jesus. Well, I sleep with my dog, and I know occasionally he gets upset with me and goes all the way over to the door and hangs out there, the bedroom door, and on the floor. And I think he's mad at me about something, and I never can figure out why. That could be it. Occasionally, though, I fall asleep before him, and he snores.
Yeah.
The dog snores. I
Yeah.
mean, what do you do with? I'm not asking you to heal the dog, but they deal with the same things, right? I mean,
Yeah.
they can have the same problems.
Yeah, fix yours and maybe he'll sleep better.
I'll get an appliance for his mouth.
Yeah, here's my advice. Get the pets out of the bedroom.
Ooh.
That's a big cause
very
of
much.
sleep disruption.
Some things I can't give into. That's a big one for me. He's my healer. He's
Yeah,
a
that I
wonderful
know, but
healer.
in moderation.
Yeah, in moderation. Okay.
Yeah.
I'll work on that part. But I do think you make great points when you talk about acid reflux.
Yeah.
So many people are on different varying stages of that disease, or they have that problem, but it's in varying stages, so they don't know how bad they have it. So they go to sleep at night and they have this waking up, or like I have had a sense of pressure over my lungs, or can't get a full breath. You probably have more of a critical problem going on in stages like that.
Yeah, some behavioral things you can do for that. You can elevate the head of your bed by about 30 degrees. You can do that by putting plywood under the top of the bed, not the bottom of the bed, so there's a little angle.
Mm-hmm.
You can buy those triangle pillows, and you can get them like Drug Emporium, pharmacy places.
I mean, like a wedge.
Like a wedge,
Yeah.
Because when you're laying flat, you're going to have more acid reflux in your throat, and you're going to have more sleep apnea when you're laying flat, just the effects of gravity.
Yeah.
So sometimes if you have mild sleep apnea, that's one of the things we can do to treat is elevate the head of the bed a little bit. And some people say, well, I'll just use 2 or 3 pillows, but the 2
That's what I
pillows,
do.
well, they kind of get knocked around at night a lot of times.
Yeah, they do.
Yeah. So if you've got the wedge or if you've got your bed elevated, it'll kind of help with the gravity.
Okay. Well, that's doable. I can see that as being, because I deal with all this stuff really on one level or another. Now, as Dr. Bailey said, the apnea is basically the cessation of breathing for up to 10 seconds, which seems very dangerous. I know when you're in a lower state of being that your breath can get slower, and it's not so bad. But starving your brain has got to be a bad thing. And dangerous. What's this dangerous number 2? Is that O2? Dangerous level of O2?
Oxygen, yeah. You know, we all have a little bit of apnea, and we kind of judge it by what's called the apnea-hypopnea index, which is how many apneic episodes you have. And 5 or less is normal. 5 to 10 is mild. And during that mild stage, we can treat with a lot of the behavioral things. You don't necessarily have to have a CPAP mask unless you have other associated factors like diabetes or depression or high blood pressure or heart disease, and then you may want to consider it. But then from 10 to, say, 20, 30 is moderate, and above 30 is severe. And the dental appliances can help with just snoring for people who have snoring and feel unrested and their apnea is less than 5. It can also help with mild to moderate and sometimes in severe. You can use the dental appliances even with a CPAP mask.
I want to talk more about that. We're past a break time here, and I want to go in there so we can get back and get on these subjects. And we invite you to be part of the program, too. So if we're hitting a subject here that applies to you, if you've used the mask or using it now, found the best possible way to use both appliances, perhaps you've been trying both and they're working for you, or they're not. It's okay. Call us up and let us know. If you don't really want to talk firsthand, use my name. I use Gary when I call into talk radio stations. I always say, this is Gary from Charleston. and then I can say whatever I want. So you can be Gary if you want for the day, or you can call in as your own self. That's fine. If you're willing to talk, maybe you're helping somebody else as well. So give us a call at 345-5858, 345-5858 on 58 WCHS, the voice of Charleston.
Local news, local talk, and local sports are as close as 580 on your radio and absolutely free on 58 WCHS, the voice of Charleston.
Let's face it, there are some things you'd rather not talk about, like where babies come from or your wife's old boyfriend. Talking about prostate cancer isn't easy either. However, it is good to know that the prostate care professionals of West Virginia are there to help maximize curing cancer while maintaining optimal organ function and quality of life. For individualized, comprehensive care, talk to the prostate care professionals of West Virginia. Visit us on the web at pcpwv.com or call 342-9900.
I'd have them back in my house anytime. They did a great job and were very well-mannered.
They put everything back where it was before. They even vacuumed. Those guys were professional.
Who are they talking about? They're talking about Big Kenny, Little Kenny, Timmy, and Mark, the flooring installers from ESC Carpet, Tile, and more. And unlike box store subcontractors, these ESC employees know their name is on the line with every job. Right now, ESC is celebrating their anniversary by rolling back prices. You can see the savings for yourself when you visit their showroom. Also, during this event, ESC installers will take up and dispose your old flooring absolutely free. Find out how much you can save. Estimates in the Charleston area are free too. Then maybe you'll be singing the praises of ESC installers as well.
That little Kenny is a cutie, and he's so sweet. He did an awesome job installing our carpet. We couldn't be happier.
See your ESC flooring consultant today and save during the ESC anniversary event going on now. ESC, just beyond left field of Power Park downtown.
Make the great outdoors even greater with a Bobcat 3400 or 3450 4x4 utility vehicle. This hard-working equipment is ideal for farming, hunting, and recreational activities. Available now at Bobcat of Advantage Valley in Cross Lanes. Their gas engine and diesel engine offer exceptional power and performance with top speeds reaching 30 miles per hour. And their composite cargo box is designed to handle tough loads. Experience greater payload capacity, control, and convenience with a Bobcat 3400 or 3450 4x4 utility vehicle. Visit Bobcat of Advantage Valley in Cross Lanes.
It delays a driver's reaction as much as being legally drunk. This is Corporal Jones with the Charleston Police Department. Distracted driving is a real danger to you, your family, and friends. Using a cell phone, grooming, eating, or even adjusting your radio constitutes distracted driving. But when you text or surf on your cell phone, you're taking a visual, manual, and cognitive action away from the road, and you're 23 more times likely to crash your car. Never drive distracted. Your life could depend on it. A message from the Metro Valley Highway Safety Program.
With the high cost of travel these days, turning the backyard into your personal vacation destination with elements from Peerless Block and Brick makes more sense than ever. Things like water features, fireplaces or fire pits, concrete and natural stone pavers, and other design pieces will transform your space. Use Peerless for everything from design to completion, or let them show you their new line of build-it-yourself hardscape kits that will make you look like a pro. Visit Peerless Block and Brick in St. Albans or online at peerlessblock.com and on Facebook.
Backyard getaways begin with Peerless.
Now through Sunday, shop Gap Outlet and save up to 70% off styles for the whole family. Plus, this week, get spring sweaters for men and women, just $14.99. And save 40% off everything at Banana Republic Factory Store. 40% off everything. Plus, great deals like our men's linen shirt, just $14.99. Hurry! To find a store near you, go to gap.com/outlet or bananarepublic.com/factory store.
All right. Okay, we're back, and we've got a call. Johnny over in Charleston. Good morning, John. Thanks for being on the show with us this morning. What are you dealing with, and what would you like to share with the doctors here?
Well, I have sleep apnea, but I'm having problems. I have CPAP also, and I sleep with 4 pillows. I have my bed up also, and I'm still waking up gasping for air in the middle of the night. And they've turned my CPAP unit up, and that's not working either.
Have you tried a BiPAP unit?
Yeah, that's what I have is BiPAP.
Yeah, you have the BiPAP unit?
I do have the BiPAP.
Have you seen an ear, nose, and throat doctor?
No, I haven't seen that. I've seen, a specialist because I have emphysema and COPD and all that. But,
right.
But I just, in the middle, not even the middle of the night, 2 hours, maybe 2.5 hours after I go to sleep, I'm waking up and I can't breathe.
Right. Well, I would recommend you see an ear, nose, and throat doctor to make sure there's nothing like in your nasal airway, deviated septum, nasal polyps.
That makes a lot of sense. I've had my nose broken 9 times.
Oh, well, that might be part of it. And sometimes
I used to box when I was a kid. But, it's really starting to scare me because, I'm waking up, I can't breathe, I'm sweating.
Yes. Yeah, you've got all the symptoms.
Ear, nose, and throat doctors, I forgot his name. Tim's his first name.
Yeah. Sometimes the little thing that hangs down in the back of your throat, that's called your uvula, is large and can be getting in the way. So there's different surgeries they can do. And that's a really good point that, most people need to have an ear, nose, and throat doctor evaluate them if they have significant sleep apnea.
Okay. Is sleep apnea hereditary?
Yeah, it can run in families. It certainly can. All these
My
sleep
brother has narcolepsy and sleep apnea.
Well, we were just talking about that. Those two things can coexist, and those are really, really sleepy people. And narcolepsy especially can run in families, and so you need to have what's called an MSLT test, which is a daytime nap test, and they measure how quickly you fall asleep, and they can check you for narcolepsy.
Yeah, well, now they did when they did the sleep study in 3 hours. I stopped breathing 157 times.
I'd say you got it.
Wow.
Okay, doctor, you answered my question. Thank you so much.
All right, good luck to you.
Yeah, thank you, Johnny, for the call. And no, doctor, one other comment here. Hold on a second, John.
And John, you want to make sure you're probably not sleeping on your back, so you may want to put tennis balls sewn in the T-shirt, or make sure that you're off of your back and see that that does help you.
All right, so these are multiple ways. I noticed when we were talking about how you know it, you listened to what he said, doctor, and it was like, oh, well, yeah, you're definitely a candidate the way if you're waking up that often and in those conditions. And as he said, he's had his nose broken 9 times, I think he said, in his youth. He probably has all kinds of issues of airway obstruction going on there, so he has other conditions that are unique to him. But if you're a person who's wondering about this, is it typical that you're generally overweight when you deal with this problem?
Not necessarily. Certainly, people who are overweight and have a large neck size are at increased risk. But I've seen skinny little white females have rip-roaring sleep apnea. So that is not, you can't just say it's a weight issue. It can be an obstruction issue, a central issue. So if you have some symptoms of feeling sleepy during the day, snoring, unrefreshing sleep, restless sleep, heart disease. If you have hypothyroidism, that's another risk factor for sleep apnea. Depression and anxiety can be associated with it. Waking up to go to the bathroom. Sexual dysfunction in men can be a symptom of obstructive sleep apnea because you're not getting into deep sleep, which is where testosterone is released.
Oh,
and
really?
so testosterone levels can be low.
Okay, that makes sense. You know, a lot of things your body does, it's restoring in its deepest, is that REM sleep? Or
That's actually in non-REM stage 3 sleep. It's a deeper kind of sleep physically.
Doctor, you're going to say something there?
Yes, and the only other thing I wanted to tell John is that's why Dr. Stultz and I work together, or the other sleep physicians I work with, when people have trouble with their CPAP, not getting the back of the throat open. Yes, she mentioned surgery, but we make an oral appliance to open the airway and not necessarily turning up the pressure on the CPAP machine. That is not always the answer. Sometimes putting an oral appliance, and what that does, I always call it the pipeline. It opens up your airway so the pressure on your CPAP machine doesn't have to be as strong.
Right. Way more comfortable. And actually, as your pressure gets higher, sometimes you can have more central sleep apnea. So more is not always better. I mean, more can be a lot less, and anything you can do, like adding the appliance to the CPAP, is a major benefit. Losing weight, I mean, if you're overweight, losing even 10 to 15 pounds, you can lower your CPAP by 1 to 2 pressures.
And if you're borderline and you're not really having a need for the appliance or the machine, and you lose 10 or 15 pounds, you maybe... It's possible that your tongue and the inside of your mouth also gets fat when you get fat.
Oh,
Is that true?
Yes, the tongue gets fat.
Yeah.
If the rest of the body is getting, like your neck circumference is getting larger. Men typically get the weight around their belly. If you notice, they have the belly
I've noticed
hanging
that.
out. And then women have it in the hips. But it also gets fat in the tongue area and the back of the throat.
Yeah, I knew that was the case. Nobody ever verified that for me, but I thought, when I feel heavier, and I was on steroids for a while and went up 40 pounds immediately on a prednisone, which does that to you.
Absolutely.
And there I was, and I could feel in my mouth that it was harder to move with that thing in there. It was like, it's too much going on. And I thought, when I sleep, I'll bet that thing gets in the way.
Yeah.
And having talked to Dr. Bailey, she had explained to me that there's an appliance that will take that tongue that's in the way right now and kind of push it to the forward and give you the clearance back there. And I thought, well, that may be something I'm going to need to look at, especially if I hold the weight.
That's another reason to not be laying on your back, because if you're laying on your back flat, gravity, your tongue's going to fall back too.
True.
So that's,
true
it's
enough.
going to fall forward.
Yeah.
So.
Or just take what you could do, some doctors have told me, just pierce the front of the tongue and put a 3 to 4 ounce weight on there and let it hang outside the mouth. You don't condone that?
You know, I'm up for doing an independent study on you alone.
Well, that's because you're a psychiatrist.
Yeah, that's right.
You can start off with me and have a whole...
That's right. We can study you both from a
life.
psychiatric standpoint and a sleep standpoint.
Yeah. So you don't like my idea of
No,
that?
not so much.
Okay.
But they've actually tried that. You know, they've
Something to keep the
actually
tongue out,
pulled
right?
the tongue forward, and they've actually done surgery to make the tongue smaller. They remove portions of the tongue. So that's actually been tried before.
Huh, I wonder if it'd make you speak better, too. You never know.
Never know.
It seems like that
But
works
they
with
do
parrots.
cut that thing off the uvula that I was telling you that hangs back. It's called a UP3 surgery.
Yeah, but that's an important piece back there, isn't it? The uvula. I mean, doesn't that help filter? What does it do anyway? Is it a trip switch or what?
It hangs in the way.
Yeah. It's not a secret trip switch or something.
No, you can certainly live without it.
Okay.
And one of the things that John mentioned, that he was a boxer, and you can think of that uvula. You know, when you practice, John, with the bag where you hit and you get a rhythm going, how many times that's vibrating. When you snore, the uvula is going 20 times per second sometimes. So when you hear someone snore, that's the back of the throat actually flapping, almost like a boxer hitting the punching bag 20 times per second. So that's the snore that you hear.
That's a great point, and that even gets swollen. The uvula gets more swollen, you know, towards
you
the
beat it
morning
up.
because you've been, yes, right.
Wow. That's incredible. So, I mean, again, what's that uvula there for?
To hang in the way.
I mean, it must have had some purpose back in the days of, you know what I mean?
Preventing big things going down.
Big things going down or something. It must have had something.
But you certainly can live
not
on
so
without
much
it.
now. It's like a tonsil now.
Right.
It's just extra meat back there, and it does get in the way.
Yeah.
Okay. Weight gain we considered as a problem. If you're carrying extra weight, you're probably carrying it in your mouth as well. These are concerns and problems. What's it say here about if you drive a smart car, there's plenty of room. If you drive a big car, there's less room. Is that an example of what do we mean by how it works in the body?
Right. Well, you know, I give the analogy of if you have a big car, which if you have a big tongue and it's parked inside of your mouth, you know, there's not enough room. You have to drive in carefully and make sure you don't scrape the sides of the car.
Yeah.
So the bigger the tongue, the harder it is to park in the garage. Now, if you have a smart car or a little teeny tiny car, then you have plenty of room on each side. So the more weight you gain, the fatter your tongue gets.
Mm-hmm. Okay, I see that very clearly. And again, we invite you to be part of the program. So if you're dealing with these things right now, or you have some questions about it and like to explore more about how it's affecting you, if you're using some of the treatments and you want to discuss those with us, we'd encourage you to call us now at 345-5858. And like Johnny did, we appreciated that call. And tell us how it's working for you or not working. You're talking to two great people here who can take you to the next step if things aren't working out for you. 345-5858. The call will come into our studio, and Anthony will receive that and put you in for the after-break discussion. So we'll get you in there right after this break on 58 WCHS, the voice of Charleston.
News whenever you want it. Go to 58WCHS.com for the latest local and national news anytime. That's 58WCHS.com.
They say the best things in life are free. So, hey, why are we paying so much for our basic information and entertainment needs? The average cable TV bill has more than doubled in the last 10 years. The price of movie tickets keeps going up. So, exactly what is free today anyway? Well, you're listening to it. Local radio. Support the advertisers that support this radio station. And keep listening. We won't send you a bill. There are still some things you just shouldn't have to pay for.
I like a weed-free spread. That's how I roll, so I reach for Roundup Extended Control. Driveway patio, I spray just once, and it's adios weeds for up to 4 sweet months.
Roundup Extended Control.
It's the one folks trust. Roundup's the master. Anything less could spell disaster. Kills weeds dead and kills them quick. Get yours now. You got weed butt to kick.
Roundup Extended Control.
Want weeds gone? Roundup's the way. The top weed fighter in the USA.
Roundup Extended Control.
Spray once, stop weeds for months. Always follow label directions.
The T in Turnpike means trucks.
Wouldn't it be great to drive a vehicle that actually saves you money at the pump? Yes, it would. Swap your ride at Turnpike Ford and take advantage of great offers on a fuel-efficient Ford that'll keep you saving money down the road. Right now, Turnpike Ford has savings up to $6,500 off MSRP on a new 2012 Ford Escape and up to $7,000 off MSRP on a new 2012 Ford Fusion. Need a truck? Save up to $10,500 off MSRP on a new 2012 Ford F-150 with EcoBoost technology. Saving money? That's a good thing. Saving money on a fuel-efficient Ford? Now that's a great thing. Swap your ride and save at Turnpike Ford with 2 convenient locations in Charleston between Canal City and Marmette, in Huntington 3 blocks down from Marshall Stadium, or on the web at turnpikeford.com.
The T in Turnpike means trucks.
The Humane Society, church choirs, 4-H. What do these efforts have in common with West Virginia's natural gas industry? They have Tiffany Buffington in common, a senior analyst for Dominion and an animal lover who helps raise money for her local Humane Society. And Phyllis Hinterer, a Dominion Director of Operations who helps direct kids in hands-on science projects through 4-H. And Melissa Hetfield Atkinson, an environmental specialist with Chesapeake, who also specializes in singing in her church choir. West Virginia's natural gas industry is filled with confident, seasoned professionals who are willing to share their free time and priceless talent with others. Because that's what we do in West Virginia, and why Energize West Virginia is proud to support the people, the places, and the environment that make our state a great place to live. For more information about the great things happening in the natural gas industry, visit EnergizeWV.com. Tiffany, Phyllis, and Melissa, people with the energy to move West Virginia forward.
Making a move is a big decision. Whether you're considering purchasing your first home, upsizing or downsizing, or just refinancing your current home, United Bank can help. Mortgage rates are at historical lows. There's never been a better time. And our experienced lenders make it easy to find the solution that's right for you. Call or stop by any United Bank location to find out more. United Bank, at your service. Equal housing lender, member FDIC.
Well, we're back and we're talking with Dr. Jeannie K. Bailey, a regular visitor here on Ask the Expert. She brought along with her today a sleep study specialist. Dr. Stultz is here as well. So we have you covered in a variety of ways here in order to get your questions answered. We'd like you to be part of the program at any time you feel comfortable doing that. Call in and tell us how apnea is affecting you, whether you suspect you may be dealing with sleep apnea, the causes of it, and how you're being treated with it as well. And both of these folks can help you in a lot of ways. I wanted to ask the question, too, just to expand a little more on the kinds of things we do daily that would increase our vulnerability to sleep apnea. I'm getting at drinking, for example. If you're a drinker, that's one of the concerns, right? How does that work? How does that become an issue?
Right. Anything like sedatives or hypnotics, anything that kind of relaxes your muscles in your body can also relax your throat muscles and your breathing muscles.
Okay.
And so once again, if you're laying flat and you've got the gravity effect, and then you've got the airway kind of, relaxed and not breathing, that can make a huge difference.
Okay, so alcohol, drugs of any type.
Right. And here's another one that people don't think about, smoking.
That does it too?
Yes, and if you're going to smoke, people get up in the middle of the night and one of the first things they do, grab a cigarette.
Yeah,
and that causes more insomnia, but also can contribute to increased apnea. So if you're going to smoke earlier in the day and stop close to bedtime. But smoking, alcohol, sedatives prior to bedtime, you should avoid those. You should avoid heavy meals. I think you mentioned that earlier, before bedtime, because those can all make sleep apnea worse.
I've felt that before, that it just your body tells you this isn't a good thing after you've eaten and you're laying down and it starts to feel bad. There's a reason.
Right.
You haven't given your food enough chance to move around in there and be digested properly. So avoid that if you can. And sedatives. Now, some people take sedatives because they have to, just to get to sleep at night. Is that also a contributing factor? And good, bad type of thing?
Yeah, good, bad. And it depends on the sedatives they're taking. Some of the newer sleep medicines that we have out there now, like Ambien CR, Lunesta, Sonata, those drugs don't have the respiratory effects that some of the older sleeping drugs that are like the benzodiazepines, like Xanax or Klonopin.
They actually work on the system of muscle system.
Right, and those would cause more sleep apnea.
Okay.
So if you're going to have a sleep aid, need a sleep aid, one of the newer ones would be better.
I don't
if
expect you to be an
apnea.
expert on this, but say Ambien, and I know that's in the same category as Lunesta and some of the others. What are they doing different than we know the others are slowing down the muscle, relaxing muscles to the point where you might not breathe effectively. What is the Ambien type of drug
They're
doing?
actually working on different neurotransmitters in the brain, and so it doesn't have the same effect in your body.
Okay.
And they're in and out of your system faster.
Which is why you don't wake up groggy a lot
Right.
of the times from those.
Right.
You just get the sleep, and then when it's over, it's over.
Some of the other medicines like Klonopin and Valium can stay in your system a long time, and so you feel hungover in the morning. And these drugs get out 6 hours, 7 hours. It's in and out, and you're a lot more refreshed in the morning.
Okay, so if you're going to have that or you need it, those are probably the better choices of drug.
Right. Well, we also use different things to help with sleep that doesn't actually fall in the sleep medicine category. Like if there's chronic pain and insomnia, we'll use Neurontin or Lyrica. If there's depression and insomnia, we'll use one of the sedating antidepressants. Sometimes we use the sedating antidepressants even if there's only a little bit of depression or anxiety.
Isn't that kind of an oxymoron? A sedative, what did you call it? Sedative?
Antidepressant.
Doesn't one kind of lift you up, and the other aspect of that definition?
No, we have some antidepressants that are more energizing that you take in the morning, and we have some that are clearly more sedating.
And what,
we give them
what's the good of an antidepressant that's sedating? I'm asking the wrong questions, aren't I?
That's
in my
fine. That's
head.
questions people have. Remeron, we use Remeron. Sometimes we use things off-label, even in the antipsychotic kind of family. Like Celexa or Lexapro. I use Lexapro for people who have insomnia and tend to ruminate at night.
Yeah.
Like they lay down and start getting things on their mind, and they're going over it and over and over it. And Luvox first came out for OCD, but it's also a good antidepressant. But it can help people with sleep. And with insomnia, you really have to ask a lot about restless leg symptoms. That's a big sleep problem. That's a big cause of insomnia that people overlook. Where of the evenings when you're trying to get ready to go to sleep, your legs feel itchy, crawly, you got to stretch them.
Yeah.
You get in bed and you're kicking your covers. You just can't get comfortable. That's called restless leg syndrome. And we treat that a little bit different. Sometimes we use Neurontin. We actually use the Parkinson's drugs for those, like Requip and those kind of drugs. And you have to start the treatment around dinner time, like give a dose around dinner time before your legs get all worked up, and then another dose at bedtime.
Okay.
So you got to look into the insomnia stuff. And if you have the restless legs, something as easy as adding a multivitamin with iron can help, because the calcium, magnesium, folic acid, and iron in the vitamin can help with that.
Wow, so there are simpler ways, and that's your point. I get that with it. Dr. Bailey, what's the percentage of people that are actually dealing with sleep apnea in our culture right now?
They estimate about 1 in 5.
Wow. On some level, 1 in 5 is dealing with something that's obstructing their good night's sleep.
Depending upon the study, isn't that what you find, Dr. Stoltz? It's like 1 in 4, 1 in 5. That's about the average.
Right, and it's increased in males until menopause. And then it's almost equal, males and females. Females with this disorder are often very underdiagnosed because they're not as heavy, and we think of it as a man's disorder. But especially once you hit menopause and the hormones are different, the risk of sleep apnea goes up. Even females with polycystic ovarian syndrome have an increased risk of sleep apnea. So I think, we're missing out on the female population a lot.
Is it possible that some men, I'm just speaking for men right now because they seem to be the big snorers to me, that sometimes they snore and don't have any other symptoms, they just snore and wake up refreshed?
Sure, and that's called upper airway resistance. You can snore and not have sleep apnea.
Okay.
But, most of the people are not sleeping with their bed partner.
No.
So I make an oral appliance on those type of individuals so that I can get people sleeping back with their bed partner, which that's a devastating thing.
So you're also a marriage counselor.
Yes.
There you go.
My hygienist, for example, didn't sleep with her husband for 3 years So we made her an oral appliance because she is claustrophobic and cannot tolerate a CPAP. So she was a good candidate for an oral appliance, and now she can go back and sleep with her spouse, which is great for the marriage.
Well, hey, yes, very much so. And I think that's this oral appliance concept seems really, really good to me, because it would seem to me a lot of people would resist the mask process if they could. And maybe it comes down to the point where they're actually happy to have it because it does get them through a good night's sleep. But until they get to that point where they know they have to have it, they probably are willing to try the apparatus in the mouth and see if they can open up the airway. And that's basically what it does, right? Pushes the tongue out of the way? Or what's it do?
Well, it moves the jaw forward. In some cases, not always. And it just opens up the magic pipeline so that you can keep the tongue out of the back of the throat.
Okay. And this is as easy as having it fitted like you would have denture fitted for your mouth.
Oh, absolutely.
Basically.
It's very, very simple. We make impressions of your upper teeth and your lower teeth, design the appliance, and we follow it very closely. Now, of course, I do have to have the diagnosis from the sleep physician first.
That would be Dr. Stultz.
That would be Dr. Stultz, or a board-certified physician, and then your insurance covers this. So it's very important to not only have the diagnosis to make sure you have no other medical problems
but
involved.
it becomes a medical problem then.
Yeah,
and then
this
you
is
can
a
treat
major medical issue.
Yeah, it would seem to me it is, because not only is it discomforting not to have a good night's sleep, but it affects your productivity at work. It could affect your productivity when you're driving, which can be a major problem.
Absolutely.
Because then you just start developing. Could this also be the offshoot, or could an offshoot of this be that we talked about narcolepsy?
Right.
Is that
yeah? Those disorders can coexist, and I think we're more inclined to look for sleep apnea and kind of forget that if they're still sleepy, you got to look for something else. Narcolepsy people are extremely sleepy. They frequently nap. They have irresistible urges to nap. They have periods that's called cataplexy. And cataplexy is where you have any strong emotion. It may be where you're laughing, you're surprised, you're scared, and you get a weakness in your body. Like it feels like your arm muscles get weak or your neck muscles get weak.
Wow.
And that's called cataplexy. They can also have what's called hypnagogic hallucinations, which is a period of time when you're going to sleep, like in that transition with sleep, where you sense a presence in the room or think you hear voices or some odd sensations. The other thing they have, and you don't have to have all of these to have the diagnosis of narcolepsy, is sleep paralysis, where you wake up in the morning and you briefly feel like your brain's awake and your body's paralyzed. And so those are,
yes, I've been there.
Yeah, well, that can be associated with sleep apnea or severe sleep deprivation or with narcolepsy. So it could be a combination of things. And the thing about narcolepsy often starts in adolescence with just the hypersomnia, being sleepy and falling asleep, and they're kind of labeled as, quote, lazy kids,
Yes.
or they're having trouble in school and they have an undiagnosed sleep disorder.
Yes, I understand that. I used to come home from school, and I was a wiry, highly involved kid. I mean, involved in all kinds of activities. But when I'd get home from school, I wanted to lay down and take a 40-minute nap or something like that. And then I'd be ready for a whole other day.
Right.
I mean, that was all I needed, but I needed that, and I could fall asleep very easily. As soon as I went up and laid across my bed, I'd be asleep in 3 or 4 minutes. At night, I'd spend 3 or 4 hours getting to sleep.
Yeah.
But in that little nap time, I could go off real quick.
Real fast, yeah.
This is all inspiring stuff that people can be treated. That we can avert much bigger problems by virtue of correcting a sleep issue. There's multiple ways to do it. The mouth appliance, the CPAP, all these things are available to you in varying forms. But you have to have the sleep studies done in order to get yourself on the right track. You have two experts here. Dr. Stultz is a sleep and behavioral health doctor. She's likewise a trained and board-certified psychiatrist,
Right.
but practices this because this is where you found a need.
Right.
You really wanted to serve. Dr. Jeannie K. Bailey, likewise, has been doing this work for a long time, has found Dr. Stultz to be a colleague that she works closely with because one serves the other. You need both of these people in order to ferret out what's going on with you and how you can fix it. Now, I would encourage you to be in touch with both of them, and we're going to tell you how to do that right after this 1-minute break. It's a very short one, so if you want to get a call into us now, you have to do it quickly, 345-5858. We'll be right back. We could take that call, and we'll also tell you how to be in touch with them. Right after this on 58 WCHS, the voice of Charleston.
Can't sleep at night? Listen to the new Red Eye Radio Show, 1 to 5 a.m., 7 nights a week on 58 WCHS, the voice of Charleston. The voice of Charleston.
The clock strikes midnight, and Ludwig van Beethoven has a fateful decision to make. His music's legacy or the loss of his eternal soul. Come witness Trans-Siberian Orchestra's story of Beethoven's last night. May 1st at the Charleston Civic Center. Tickets are on sale now at LiveNation.com, Ticketmaster, or Civic Center ticket office. Trans-Siberian Orchestra's Beethoven's Last Night.
They say the best things in life are free. So, hey, why are we paying so much for our basic information and entertainment needs? The average cable TV bill has more than doubled in the last 10 years. The price of movie tickets keeps going up. So, exactly what is free today anyway? Well, you're listening to it. Local radio. Support the advertisers that support this radio station. And keep listening. We won't send you a bill. There are still some things you just shouldn't have to pay for.
Now we're back and we've got a call trying to get up here. Yes, I see that we have Cad. Looks like Cad from Hurricane. Thank you for calling in this morning, Cad. We're kind of on a time constraint. If you go right to your question or comment, we'd appreciate it.
Okay, I've been a championship snorer for years. And, I finally had a sleep test and got a device and started sleeping with it, and the snoring went away.
A mouth device?
Yes.
Okay.
It's a nasal device.
Okay.
And however, it also has one of those water reservoirs inside to keep everything nice and moist.
Mm-hmm.
But I'll wake up 2 or 3 times during the night. My throat is so dry. And so, I would think that, something's not working. Either I'm still snoring. My wife says I don't. But, there's something going on that makes my throat so dry. Is there any answer to that?
Yeah. Oh, go ahead.
You're probably mouth breathing.
Right.
So when you have the nasal device on, you're still mouth breathing, sir.
Well, the air that blows, into my nose from the device, if I start breathing through my mouth, it starts rattling and making funny noises and everything else.
Hey, here's what we're going to have to do, Kat. I'm sorry to have to break in, but we do have to leave the program right now. Give a call to Dr. Bailey at 304-757-7428. You can also get in touch with Dr. Deborah Stoltz at 733-5380, 733-5380, or look them up in the book if you care to. Dr. Jeannie K. Bailey, Dr. Deborah Stoltz. Appreciate you calling in. And everyone who's with us this afternoon, stick around. Hoppy's up next. He'll have Steam Release Friday for you as well. I'm Rick Cochran, back
This
on
is
Monday.
WCHS AM Charleston. WCHS AM Charleston, a West Virginia Radio Corporation station. It's 10 o'clock. 10 o'clock.
On in Sanford, Florida right now for George Zimmerman, the neighborhood watch volunteer charged with second-degree murder in the shooting death of teenager Trayvon Martin. Zimmerman's family members have been testifying on his behalf, but they aren't there in person. ABC's Aaron Katursky has the latest.
State of Florida versus George Zimmerman.
In a dark